In the mixed phase of Paz disease, we now have bony repair occurring where there's thickening of bony cortex and coarsening of the trabeculae as part of the repair process. So here in the knee, at the distal femur frontal radiograph, you can see, compare the trabecular pattern here in the distal femur and the proximal tibia. This is much more fine, and this is much more coarse or thick trabecular pattern. This is characteristic for Paz disease. Here in the humerus, proximal humerus, trabecular pattern here is also subtle, but definitely thickened. Thickened trabecular pattern. Here in the pelvis, on the left femur, you can see there is thickening of the trabecula again compared to the right, normal right side, to the abnormal left side. And also, look at the cortex. Very thick cortex here in the proximal diaphysis and at the femoral neck, comparing that abnormal side to the normal right side. So thickening of the cortex, coarsening of the trabecular pattern. Once you say those words to yourself, it's Paz disease. You don't really need pathology. It's diagnosed on X-ray. Another example, a little bit more subtle, of some trabecular thickening on the left side. More subtle than the last case. In this patient, there is involvement of the left femur, enlargement of that left femur, cortical thickening, trabecular coarsening, and patient had a pathologic fracture, now needed ORIF, needed fixation here. Oftentimes, the first sign, first clue you will have for Paz disease on X-ray is this: the thickening of the iliopectineal line. Right, this is the iliopectineal line forming the pelvic rim over here. If you pay attention, the thickening of the iliopectineal line, especially if it's asymmetric on one side, is often the earliest precursor, earliest sign that there's Paz disease. In this patient, it's very subtle. People see that? You see which side is abnormally thickened? Right here. Yes, very good. So right here, thicker than the left side. This patient has very subtle early signs of Paz disease here in the right hemipelvis. In the spine, the thickening of the cortex can result in this so-called picture frame appearance, where all four sides of the vertebra are thickened, and now it looks like a picture frame, something you put your photograph or your painting inside.